The Cancer Society says the number of lung cancer deaths among American men is expected to drop during 1990, the first such decline since the society started keeping count 37 years ago. A society spokesman says lung cancer deaths continue to increase for men over 65, but they're more than offset by less cancer in younger men who have quit smoking. Linda.
There are as many as 500,000 gallbladder operations performed each year in this country. And the good news is that a lot of that surgery can now be done on an outpatient basis. And our medical specialist, Steve Yandell, is here with the details.
But first, knowing how John Beard feels about surgery, here's a little note for you, and perhaps you'd like to share it with our viewers.
What is this? This report contains scenes of actual surgery. It has been carefully edited for viewing at this time. Well, I hope so.
That's right. That's right. There are only about 3 seconds inside the body and no blood.
That's about 2.5 seconds too many.
No,
but let's go.
Let's go. All right. You ready? Go. As we've reported, there are many, many, many ways to take care of gallstones. There's medication, shock waves, lasers, even ether fumes to dissolve them. But many patients will still need surgery. Ginger Foster had her gallbladder removed at Martin Luther Hospital in Anaheim. Without the usual 4 days in the hospital, she didn't even stay overnight, and she was back at work in a week instead of the usual 6 weeks recuperation.
I said, that's what I want. I have 2 kids at home. I don't have time to be recuperating. I want to be able to pick them up and get on with things.
To do that, surgeon Miguel Velez will do laparoscopic laser cholecystectomy. Well, that's a fancy way of saying instead of opening up the abdomen, he'll insert tiny instruments through 4 tiny incisions to do the work. A laser helps cut the gallbladder loose, and without the trauma of a large incision, recovery is quicker and easier.
It allows you to do the operation as an outpatient. It allows for the patient to go back to work usually within a week, and it avoids the usual 6 weeks disability that's encountered by the patient.
In doing this, surgeons are borrowing a page from orthopedic surgeons who for years have been doing arthroscopic surgery through just tiny incisions in the knee. And they're borrowing from gynecologists who pioneered laparoscopy, working through just tiny incisions in the belly button. And there you can see on Ginger, just 3 little marks is all that shows. The technique was first reported in the medical journals just a year ago from Tennessee. Dr. Velez was the first to introduce it on the West Coast, and it's rapidly spreading elsewhere. The Wall Street Journal says patients can save up to $1,000 on their hospital bills. For Ginger Foster, it was the convenience that counts. She wouldn't have it any other way.
And within a week, when most people would just be getting out of the hospital, was eating bratwurst and corn on the cob with them, and it was unreal.
The technique not recommended for emergency gallbladder surgery, also not recommended for cases where gallstones have slipped down into the bile duct. But otherwise, if you're scheduled for gallbladder surgery, you may want to ask your surgeon about this new technique. By the way, the doctor that I interviewed today, for your information, Dr. Miguel Velez, 714-772-6701. It's at Martin Luther Hospital in Anaheim, 714-772-6701. And before I run off today, one other item very quickly, an update on problems we've reported on which may be linked to the food supplement L-tryptophan. Well, the State Health Department